right, party people. Question time. Let's get it. So if I was to give you a patient, a female, 63 years old, with a 25-pound weight loss in the last 2 months, I also tell you that she has mild anemia. As far as normal reference ranges for hematocrit, understand that for females, it's around 42% plus 5 minus 5. Or for males, it's 47% plus 5 minus 5. Just memorize these. Now, I also tell you that this particular patient has a normal MCV. And that normal range is 80 to 100. She's also suffering from hyponatremia. For reference, the normal range is 135 to 145. She has a history of smoking. She has hypertension. Now I'm going to ask you, why did she lose weight? And here are the option choices. A medication side effect. B, latent infection. C, paraneoplastic syndrome. D, cytokine effect. Or E, renal insufficiency. Please make your choice. And boom. Cytokine effect is the correct answer. I hope you did not pick paraneoplastic syndrome. All right, let's get into why the correct answer is the correct answer. So we have a smoker with hypertension, hyponatremia, anemia of chronic disease, as well as weight loss. Now this is textbook for small cell bronchogenic carcinoma with paraneoplastic SIADH. Now the SIADH will account for the hyponatremia. However, her weight loss and anemia will be due to the cachexia from malignancy. Cachexia, sometimes pronounced cachexia, will be caused by TNF-alpha. Now, TNF-alpha is a cytokine. Let's recap as to why paraneoplastic syndrome is wrong. It's wrong because we asked about the cause of cachexia, her weight loss. Now, SIADH is the paraneoplastic effect of small cell carcinoma. However, cachexia or cachexia is caused by TNF-alpha. TNF-alpha is also known as cachectin or cachectin. So this was a little bit of a gotcha question, but it's important to go over these because sometimes we jump to conclusions. I would urge you to read the last sentence of every question very carefully. Key point number 1, don't jump on the answer that you think that it is right away. Calm yourself and think. And number 2, please know that TNF-alpha causes cancer-related cachexia. The immune system may produce it in response to the tumor, or the tumor may produce TNF-alpha directly. All right, let's do a little paraneoplastic review. SIADH results in hyponatremia. You can have ectopic ACTH. This is a result of Cushing's syndrome. For Lambert-Eaton syndrome, we have antibodies which are targeted at presynaptic voltage-gated calcium channels. We can have cerebellar degeneration, which results in ataxia. And we're going to have antibodies, anti-HU, anti-YO antibodies. For squamous cell carcinoma, we can have PTHRP, which causes hypercalcemia. Please note that this is not the same as PTH. It works in a similar fashion, but it is a separate hormone. We have adenocarcinoma. Now, normally, the textbook example is the head of the pancreas. However, this can also be seen in bronchogenic carcinoma. And typically, adenocarcinoma results in Trousseau syndrome, which is migratory thrombophlebitis. This is due to the release of tissue factor 3. Also, we can have large cell carcinoma. This can result in gynecomastia due to the increased estrogen production. All right, that's it for this one. Go crush it.